Welcome back to my channel, guys. It's Tony's Tips and Treasures, and I just want to say thank you. I've been loving the likes and the subscribes that I've been getting so far. Thank you, guys. So today I want to start the celebrations for Diabetes Awareness Month. So November is Diabetes Awareness Month, and it's one of my favorite commemorative months. And so I want to start my series of talks. Let's talk diabetes. And the first one is debunking the myths in diabetes. So let's get it going. So myth one. So a lot of my patients come to me because as a nutrition consultant I have my own practice, and I find that in the management of diabetes, when I ask questions, my first question from my patient is usually that diabetes is caused by eating a lot of sweets. So that's myth one. So let's start to tackle that. So you have two major types of diabetes, which is the type 1 and the type 2. Type 1 is autoimmune, and type 2, it usually develops because of genetics, so it's passed down through your family genes or as a result of lifestyle. It's not necessarily that you eat too much sweets. Yes, that can be a reason why, but it's not only because of that. It can be passed down through your genes, be as a result of unhealthy eating otherwise. So it's not necessarily because of that. So that's myth one. So you're challenged with diabetes and you're wondering why it came about. That's the reason why. It can be genetic or it can be as a result of an unhealthy lifestyle. Let's go to myth two. So people with diabetes can't eat sweets or carbohydrates. Yes, carbohydrate is one of the major culprits with diabetes. But of course you need your carbohydrates just the same. How will you get your energy? How will you do your day-to-day duties, your job, play with your kids? You need your carbs. So yes, it is really the portions that matter. So when it comes to your sweets and your carbohydrates, you can indulge. And don't say me saying when you have sweetie constantly. I never said that. But you mind your portions and the amount that you're eating at one go. So that's myth two. So get it out of your head that you can't eat it. I know a lot of persons come and say, me just want to know women to eat from women of eat. You can eat your things that you like. You just need to exercise portion control. Alright, so let's start with myth three. So I've had patients that come to me and say, but this disease only affects people who are older. No, it doesn't. As a matter of fact, you have what you call juvenile diabetes, and you have children who have been born with diabetes, right? So it doesn't only affect older persons, it can affect children, it can affect you in your young adulthood, as well as it can be something that you find out later on in life. But you do have juvenile diabetes or children who have been affected with diabetes who in fact have to use insulin to help them to manage their diabetes. So myth four. This one I laugh at a lot. You can catch diabetes by going near to someone. So in fact, diabetes is a non-communicable disease. And when we say non-communicable disease, we mean that it can't be transferred from me to you. Like how you come near me when you have COVID and you cough on me and me get it. COVID is a communicable disease. So you can get it if you go beside somebody and they cough on you, or you get something from them. So it is a non-communicable disease. It can only be passed on through the genes or as a result of unhealthy lifestyle. So if I have diabetes and I'm playing with you, like a child asked me that, can my friend get it from me if I play with them? No, you can't get it like that. It's a non-communicable disease, and so it can only be had by genetics or through unhealthy lifestyle. So that's myth number 4. Myth number 5. People with diabetes are more prone to infection. Yes, for some women, yeast infection is actually one of the symptoms of diabetes, but it doesn't necessarily mean that you are more prone to infection, right? It doesn't mean that. People, in fact, with diabetes, they have a high blood sugar level and that can impair your immune system, but it doesn't mean that you are more prone to infection than somebody else that does not have diabetes. Alright, so myth 6. Diabetes means that you will lose your limbs or go blind. So a lot of persons who have been diagnosed with diabetes, they come crying, oh my God, what am I gonna do? I work at the bush, and if I get a cut, I'm going to lose my foot and I'm going to lose my hand, and they're bawling and stress out themselves, and oh my God, me I go blind, I now can't see, I now can't help myself. Listen, if you manage your diabetes well, you are able to keep your limbs and keep your eyesight. Persons who do not manage their diabetes well are the ones that usually have problems when they get a cut and they let it go infected. That's another thing. They don't pay attention to these things, and because their diabetes is not managed, their cuts take a longer time to heal. And so if it goes to the point where the whole foot infected and they can't save it, the only way is to cut it off so that it doesn't spread to your body. But it doesn't mean that by being diagnosed with diabetes that your limbs will go or you will go blind, right? It's that you have to make sure that you manage well when you're diabetic. Alright, so you go to your nutritionist or your dietitian and you have to follow the instructions and be disciplined enough to follow through with them, because we as dietitians and nutritionists can tell you so much and no more. We can, just like old people say, carry the horse down the water, you can't force him to drink. You have to be disciplined enough to say, okay, I am going to try to manage this. I want to live a longer, healthier life. Right? So it doesn't mean that you will lose your limb or go blind. You just have to make sure that you're managing. Alright? So let's look at myth number 7. So insulin is only in severe cases. As a matter of fact, insulin is used in all cases. It is used to help you manage. So you might have type 2 diabetes and you might have to use insulin. Yes, type 1 diabetes is insulin dependent, and they say type 2 diabetes is non-insulin dependent, but it is used in cases where you are not managing. So it's not only for severe cases. Remember, when you have diabetes, your insulin doesn't work well, and so you need the insulin in order, because remember, the insulin acts as a key, as your body cells are they, you can call it that they're locked up with a padlock, right? And the insulin works like a key to unlock your body cells. So when you eat carbohydrates and it breaks down into sugar, it's not supposed to stay in your blood. So the insulin is supposed to go there, take it, and put it into the muscles to give your body energy. So when you're having diabetes, your insulin is either not producing or not working properly. So you have to remember that it works to manage your blood sugar level. So it's not only used in severe cases. Alright? So myth number 8. Diabetes means you can't exercise or play sports. As a matter of fact, is one of the three major things that you need in order to manage, right? So you need to make sure you're taking your medication, and you need to make sure that your diet is intact, and you need to be physically active. So being diabetic doesn't mean that you should not exercise, or you as a child you can't participate in sports. It's actually good for you, right? So it's not something that should be disabling you. It shouldn't be. And once you're managing well, you will be fit and fine enough to do everyday little things, right? So it doesn't prevent you from participating in physical activity or exercise, or even playing your sports. And number 9, and we're getting to the end because it's 10 myths that I have. So number 9, diabetes is a death sentence. Now this is one of the biggest things, especially for persons who have just been diagnosed. They come and they bawl, and that is what they say: I am going to die. Mind you, if you don't manage, it can be a death sentence, but it is not a death sentence. If you are managing your diabetes well, you can manage to the point where you don't even know that it exists in your body. You know how much movie stars out there? I can name one famous one right now that a lot of people I know don't know that she has diabetes, and she has type 1 diabetes. Halle Berry has type 1 diabetes, and you see how much action movie she's in? Who knows that she had diabetes? She manages her diet well. She's physically active. She takes her medication and makes sure that she is eating healthy. And so she manages well. She doesn't even, it becomes a part of her everyday life to manage, because she wants to live a longer, healthier life. But you have a lot of persons out there that take it as a death sentence, and they totally give up, and then at the end of the day, the disease don't kill them. Stress does. So it is imperative that as a diabetic that you make sure, I can't stress it enough, that you are managing well. You're taking your medication as how they are prescribed. You are eating healthy, minding your portions, right? You're eating up your vegetables, your high fiber foods that help with your diabetes, and make sure that you are staying physically active, right? So it doesn't have to be a death sentence. And I want to implore you, as it is Diabetes Awareness Month, fight as a diabetic. Fight with it. Make sure that it's not bullying you, right? Fight with it. You don't have to let it cover you down or hamper you down or bury you. It doesn't have to. And once it is managed, you'll be fine. Alright? And last but not least, let's look at myth number 10. You can reverse diabetes with diet alone. And a lot of the persons come to me, most of them in the very late stages of diabetes, when they have gone through the gate and you can't do nothing, and expect you to tell them to eat this and eat that and eat this and eat that and you'll be fine. Diet alone does not work to manage diabetes. And as I said before, more than one things work together. So you have to make sure that you are physically active, to make sure that you're maintaining a normal weight, that you get to a weight that is normal, because obesity and diabetes doesn't work because it causes insulin resistance. That's number 1. And you have to make sure that you stay at a normal weight. So physical activity is very, very important. Not only that, physical activity reduces stress, relieves your mind. It helps with so many other things that can break down as a result of diabetes. So make sure that you're staying physically active, right? Yes, you need your diet, and as a rule, you have to see a dietitian or a nutritionist to make sure that you stay on track. So the doctor should refer you. Once you get diagnosed with diabetes, your doctor should refer you to a dietitian or a nutritionist so that they can help you to plan your meals better, talk about portion sizes, reading food labels, making sure that you're spacing your meals well, eating on time, the foods that are better, the ones that you probably should stay away from, but you can indulge in from time to time, as well as making sure that you are taking your medication. And that is what I see is mostly challenging present. Medication, every medication comes with side effects. And so if you have a side effect from your diabetes medication, talk with your doctor and let them know what is going on. Let them change it to see if something else will work better for you. There's a lot of medications out there for diabetes on the market, and not everyone will work with everyone. So if you're experiencing side effects, instead of stop taking your medication, talk with your doctor so that they can work with you. So change your treatment plan and change your medication, right? So diabetes is something that is affecting the world very badly today, and sometimes our family genes let us not escape it, and so we have to practice living a healthy lifestyle. Stay away from the myths that will prevent you from managing and from being healthy, right? So bear these myths in mind. Make sure if you're diabetic that you're managing, you're doing your physical activity, you're doing your diets, right? And if you need help, I'm always here. You can call me. I will put my information in the description below as well as at the end of this video. So you can call me. I do Zoom appointments, I do in-house appointments, as well as I can even talk to you over WhatsApp. So whatever appointment you would like, I can do it for you. Just book your appointment now. Make sure that you are managing this Diabetes Awareness Month. And guess what? This is only part 1 of our Diabetes Let's Talk series. So look out for the next video. Continue to like, share, and subscribe. Our next video will be on healthy eating on a budget, Jamaican style. So I want you to look out for that. I know that's something that's challenging a lot of persons, so I want you to look out for it. Make sure that you hit the subscribe button so that you can know when the next video drops. Thank you guys, and see you soon.